Hey everyone, it's me, Dr. Whimsy. How you doing? So today we're going to be talking about a pretty interesting subject, and that is chronic disease. Chronic disease and the disease process. And specifically, I want to address chronic disease and chronic depression, or a depression that exists for a long period of time in a person who suffers from chronic disease. And the chronic disease process has been going on for so long that a person may not even be consciously aware of the fact that they are in pain. But one of the side effects of the disease process, the chronic disease process, can be depression. And specifically, I want to address the chronic disease process in the digestive tract. So how do we know that we have a situation of chronic disease in the digestive tract? The person who may not even be consciously aware of the fact that they're in pain. Now, how that happens is that initially when we start to become ill, particularly when it comes to digestive challenges, we may, if the disease process is slow enough, we may not be consciously aware of the progression of the disease. An example would be the frog that is sitting in water and the water slowly begins to boil. That is really the disease process. It happens very, very slowly over time, and as the disease process progresses, a person may push it to the side. That slow, steady, evolving pain in the digestive tract, it gets put aside. And over time, you may not even be consciously aware you're in pain. And with it comes a low-grade depression. Now, if you're a naturopathic doctor, one of the first areas you're going to be looking at is the digestive system. This is something that naturopathic doctors are extensively trained in, and that is because of this idea that the disease process begins in the digestive tract. We say that death begins in the gut. So when in doubt, when you don't know where to start, we always say start with the digestive system. Start by helping somebody experience optimal digestive health. Now, if you're looking at a situation like chronic disease, you also have to take in consideration the fact that that is an inflammatory process. So if you are experiencing digestive upset, for example, and it's a chronic disease process, there's going to be inflammation. As a result of inflammation, chronic inflammation, a series of health challenges can sometimes emerge. One of the challenges that happens with chronic inflammation is that the metabolism can be affected. We'll sometimes see changes in cortisol. If the chronic disease process is beginning in the digestive tract, we may see it start with something as benign as gas and bloating. Gas and bloating may then evolve into an upset stomach, chronic pain, gastroesophageal reflux disease. If you are just ignoring those pains, if ignoring them is how you cope with pain, then the disease process never gets dealt with, and what is causing the disease process never gets dealt with. So in that person who's experiencing chronic disease beginning in the digestive tract, we will often see that the abdominal fat is increasing, gas, bloating, upset stomach, GERD, acid reflux starts to happen. A patient may show symptoms of SIBO, small intestinal bacterial overgrowth, or irritable bowel syndrome. They may go to the doctor, test the levels, and the levels all come back normal. So that is the chronic disease process. But what also happens when you have inflammation is that your body will respond to inflammation by not only raising cortisol, but that process of raising cortisol can have an impact on brain health. And that's because elevated inflammatory markers, elevated cortisol, can actually cause a decrease in serotonin. And serotonin is an important neurotransmitter. It's really one of our happy neurotransmitters. So what is the function of all of this from an evolutionary perspective? Why did our body set itself up this way? It's probably what our body does in order to get us to rest. So whether the stress that we are experiencing is due to famine, whether the stress we're experiencing is due to stress in the home, usually our body responds the same way it did 100,000 years ago, 200,000 years ago in a case of famine. And that is, number one, we see inflammation. We see a rise in inflammation. We see cortisol begin to rise as a response to that inflammation. And then we see depression and fatigue emerge because the body is really attempting to conserve energy. And along with that, we might see changes in thyroid function. Cortisol not only will drop serotonin, but it can actually also have an effect on thyroid function. And the purpose of depression is to get you to lie down, get some rest, and conserve your energy. So if you're talking about the recovery from chronic disease, particularly if it's beginning in the digestive tract, the first thing we do as naturopathic doctors is we talk about the 4 R's, which is remove, replace, reinoculate, and repair. That is the program that I use and many naturopathic doctors use. So when we talk about remove, we want to remove the cause of what led to the inflammation in the first place. And that may be food allergy testing or removing foods that people commonly will have an allergy or a sensitivity to. Soy is often removed, gluten removed, dairy is often an allergen. Peanuts can sometimes be an allergen. You really want to find what the person is responding to, either through testing or through an elimination diet, to remove the cause of the inflammation in the first place. When we talk about remove, we're also talking about infection. If you've had a test from your doctor and it has detected, say for example, H. pylori, which is a type of bacterial infection that's associated with ulcers, then obviously we would want to remove the infection. The same is true if you have SIBO, too much bacteria in the small intestine. We want to remove that through antimicrobials. I prefer giving antimicrobials at night, and I use an herbal combination. And then second, we get to replace. And replace is when we are trying to replace the bad foods with the good foods. And usually what I do is I place the patient on a hypoallergenic or anti-inflammatory diet, at least for 21 days, just to see the gut settle down. If I'm getting improvement, then I know part of the problem was dietary. So we are replacing the bad things with the good things, and that means giving them a nutrient-dense diet that is hypoallergenic, that's removed offending foods, and we are also going to give things that are going to help replace any nutritional deficiencies a person may have. So vitamins, supplements, essential fatty acids are also important for getting inflammation down. Reinoculate is probiotics. We usually will recommend probiotics to help rebuild the gut lining. This is because when the gut lining has broken down, when it's been compromised, this can lead to inflammation, and part of the gut health challenge is to make sure that we are repairing that gut lining and reinoculating with probiotics, which will help not only help the immune system but also protect the digestive tract. And then finally, repair, which is where we will give nutrition that actually repairs the digestive tract. Glutamine, for example, is one of the most common nutrients. It's an amino acid that we give for gut repair. But there are other things we can give as well. There are herbs that can be helpful in repairing the digestive tract, like mullein, for example, marshmallow, some of what we call the mucilaginous herbs. So that is it. That is how we address chronic disease. We begin in the digestive tract, and it's also an explanation of why we see chronic disease associated with low-grade depression. What I would add to that is this is another reason why we will see a cessation of depression or an alleviation of depression when the original cause of the depression is addressed. And in the case of many of my patients, the depression is due to chronic digestive health challenges. When that is addressed and when the digestion is working optimally, a person's mood changes. This is one aspect of the brain, the gut-brain relationship. All right, so that is it. Got through it in 11 minutes. That is the relationship between chronic disease, pain, and depression, and how we address it by first starting with healing the gut. If you'd like to find out more about my work, my name is Dr. Whimsy Anderson. I'm based here in Los Angeles, but I'm also available via telemedicine. If you want to schedule an online appointment for general wellness coaching, I'm available for that. You can simply go to drwhimsy.com and click on the services page to schedule your appointment. I want to thank you for watching this quick video. And I look forward to working with you in the future. Take care. I'll talk to you later. Bye-bye.